community. I'll start with the health alert we sent out last week related to West Nile virus. As was articulated in the release, we have confirmed two cases of West Nile virus among residents here in Mecklenburg County. And we do have several additional cases that have been identified that are not active cases through blood donations. And so we continue to monitor that situation closely along with our partners at the state who have seen an uptick in West Nile virus active cases this season. As we all know, of course, it is the weather is great outside and people are outside and we want people to enjoy outdoors, but certainly want people to take precautions. Wearing insect repellent is one very important tool that we have available to us to make sure we're avoiding exposure potentially to the other West Nile and other viruses that are carried by mosquitoes. Shifting quickly to COVID-19, the COVID-19 situation in the community continues to be stable. We are continuing to monitor our data very, very closely to see what's happening with COVID in the community. Our wastewater data continues to show declines in the level of virus in our wastewater supply, as well as we know our case counts and hospitalizations have also declined over the last several weeks. These improvements are certainly encouraging, but we know we're going into the fall season. And so as we're moving into the fall season, we want to just take an opportunity to remind folks to get up to date on your COVID-19 boosters. We do have the bivalent booster, the new booster available here at the health department, as well as they are available at a number of community sites. They're available at both of our health systems now, as well as via StarMed. And so if you have any questions or concerns, you can certainly give us a call, but also you can check with your provider and they have them available. This time of year is also heading into flu season. And so we want residents to take precautions and get your flu shot as well. Again, I know it probably seems like a constant vaccination campaign, but certainly it's important for us to have as many people taking advantage of the vaccines in our community that are available because they certainly work, they're effective, they help keep people safe, alive, and well. And so we want to make sure that people are staying up to date on your COVID vaccines as we go into this fall season, as well as getting your flu shot. Now transitioning to quickly provide an update on MPX and where we are with the outbreak here in our community. We're continuing to see a leveling off of our cases and the decline that we saw just a few weeks ago that we reported on. We certainly saw a slight uptick in cases right after we had made that report. And so it's important for us to continue and to stay vigilant with our work in the community to make sure we're getting those at greatest risk vaccinated. And then most importantly, folks who are having any kind of symptoms that could be potentially similar to the monkeypox virus are in fact taking advantage of testing resources here in the community. I want to make a couple of quick data points in terms of where we are with the outbreak, and then I'll open up the floor for questions. As of this morning, we are up to roughly 201 confirmed cases of MPX since the start of the outbreak in our community. We are starting to see a slight shift in demographics. Overall, we still continue to have more than 95% of our cases are in men, and a large majority of those individuals do report being men that have sex with other men or transgender people. We have had 5 cases among women in the county, and we have had a number of individuals who have been exposed in the county as well, and so a number that we've determined to be close contacts. The demographics of our cases continue to sort of be similar to what you've heard all along, with more than 80% of our cases being among Black or African American residents. But we have seen more cases in the last several weeks among non-Black residents here in Mecklenburg County. To date, we've been able to identify 225 close contacts to those 201 cases. And again, this is just based on what we've been able to identify based on case reports and interviews and investigations. I will note that we have had several pediatric exposures in the community. There have been roughly 8% of those 225 were among children. So it's really important for individuals to make sure that if they're experiencing signs and symptoms, that they get checked, they get tested, and most importantly, that they isolate from others. If you have any kind of new rashes or symptoms that might seem like there may be MPOX, particularly if you're in those higher risk groups, it's really important that you go get tested as quickly as possible. We have had some situations where patients have delayed that testing and have been exposing individuals during that time period. And so it's really important that people, if you have a new rash or if you have those signs and symptoms, that you go get checked by a provider. If you don't have a provider, our providers here at the health department are able to see you to be able to check for any for MPOX or any potential other sexually transmitted infections that you may have, or offer any of the other services that we have here at the county health department. We continue our vaccination campaign. Again, I remind individuals, if you are eligible for a vaccine currently, that includes individuals who identify as MSM, as well as persons who are the partners of individuals who are MSM, as well as individuals who are living with HIV or on HIV PrEP medication, or if you've recently had a syphilis infection, you are eligible to come into the health department. We are accepting vaccine appointments on a walk-in basis now. And so certainly I encourage folks who are eligible. We have seen quite a bit of decline in our vaccine demand. But again, I remind people that MPOX is still here. And so it's important that people come on in and get vaccinated if you are in those eligibility groups. With that, I will end my comments for today and open the floor to any questions.
First question today goes to Claire Donnelly, WFAE.
Good morning, everybody. Thanks for doing this. So I have actually two questions. First, how much has demand slowed for MPOX vaccines? And then second, the weather is changing. We're starting to think about, the next season, and we're in kind of a new phase of the COVID pandemic. Wondering if you could speak to how folks should be thinking about the pandemic, and then if you expect there'll be a surge in cases again with the colder weather.
Sure. So, Claire, thanks for those questions. I don't actually have a quantitative metric of the demand in terms of how many vaccines we've been doing recently, but I certainly am able to get that information for you and provide it as a follow-up to this meeting to tell you sort of what our demand for first doses have been over the last several weeks. The clinic has been fairly busy because obviously this is a 2-dose series, and so we've had a lot of folks coming in for their second doses. But I'm happy to follow up on the first dose demand for the last couple of weeks as a follow-up. Certainly, I think with the COVID and the flu and the fall and other respiratory illnesses, this is sort of will become fairly routine, I think, in terms of people are used to preparing for flu season, and I think we've added COVID to the mix as well as the other respiratory viruses that are circulating this time of year. So we continue to encourage people to think about this in a way of again, multiple layers of protection. Vaccination, of course, is most critical. We want people to make sure they're vaccinated, and that's sort of first and foremost, and staying up to date on all of those vaccines. But also there are other ways. Of course, if you are more medically vulnerable or fragile, we encourage you to take additional precautions. You may consider masking, of course, when you go into crowded indoor public settings. We encourage people to, of course, most importantly, if you're sick, stay at home and watch for those signs and symptoms of respiratory illness. We don't want people spreading COVID. We don't want them spreading the flu or any respiratory illness because, again, it just causes loss of activity for a lot of people. And so we encourage people to, again, if you have any symptoms, to take a test. We have rapid tests available very widely in the community. We have testing sites set up. So feel free, if you have any symptoms, please go get tested. If you don't go get tested, please take the step to isolate from others to avoid the potential of transmitting any viruses. COVID is still real, and it's still a threat. There's still people dying every week in this community from COVID-19, and so it's really important that we acknowledge that, and that when we talk about the fact that we've transitioned to a different phase of our response, it doesn't mean that COVID has gotten any less serious. And so I think it's important for people, particularly those who are more fragile, to make sure that they are doing everything possible, and that we collectively do everything possible in our community to protect everyone.
Next question goes to Kari Beal, Spectrum News.
Hey, I had a question about West Nile virus. It's my understanding that, we have 2 confirmed cases, but the worry is that there could be more, particularly as what you were saying with the blood donations showing that was not active, but something where somebody could have gotten it in the past. So could you talk on that a little bit more? And, the severity, I understand some people just have a mild case when they get West Nile virus, where some people, they have neurological damage. So I was wondering if you could talk on that too.
Sure. So certainly with West Nile virus, it is, as you just said, there really is a spectrum in terms of severity of illness that any one individual may have, and there's not necessarily a guarantee of who may or who may not have more advanced symptoms compared to others. And so some people have no symptoms at all, or may have symptoms that are really mild and really can't distinguish that they are experiencing symptoms of a virus. And so it is important for us to ensure that we keep people informed and remind people about those preventive things that we can do, like wearing insect repellent and minimizing our time outdoors. And so that's important. And I think in the county, if people are experiencing symptoms, again, if you have flu-like symptoms or you're starting to experience any kind of symptom, it's important that you seek help, healthcare, and see a provider to be able to check to see what may be causing those symptoms.
Thank you.
Next question. Thank you. Next question, Almaya White, WSOC TV.
Hey, can you guys hear me okay?
Can you know?
Okay, perfect. And I apologize if you already answered this question. Hopped on here a little late. Can you give me a breakdown of what you're seeing right now in COVID cases in children?
Sure. So I didn't specifically speak about the demographics of the COVID cases. It hasn't really shifted dramatically throughout the entire pandemic. We continue to see, I believe, roughly 20% of our cases are in people under the age of 18. That number, of course, does tend to increase at some margin during when school is in session. And so we are seeing some of those increases similar to what we've seen in previous years with COVID-19 among kids. And of course, as cases are going down in the general population, those proportions will start to shift upward as the overall cases are starting to go down. And so that's sort of where we are today. And of course, we keep the data on demographics of cases as well as vaccinations are updated on the state dashboard. And so you certainly can check there for very specific information or follow up with us, and we're happy to answer any questions. Someone asked me earlier about what we expect for the fall, and I don't know what to expect just yet. Certainly, based on the history and data that we've seen from the last couple of falls with COVID around, we have had a surge at some point. There are a couple of new subvariants that are being monitored very closely in other countries. We continue to watch those as well and check to see the impact of those potentially on transmission. But it is definitely reasonable to think that we'll have another surge at some point during the fall winter season. And so it's important that people take the steps now, keeping prepared, having your rapid test kits on hand, making sure you get your booster doses as we go into this next fall winter season.
We have a follow-up question from Claire Donnelly.
Yeah, I just wanted to ask, we've seen kind of a slow or we did see a slow booster uptake back with the previous version of the booster. Wondering what you're seeing in terms of COVID booster numbers right now?
Certainly, we are seeing a fairly slow uptake, but supply is not as we don't have a full supply, so we're keeping up with the demand that we currently have with the supply that we currently have available. But certainly, we are seeing there are definitely the early adopters are coming in, folks who are either are more concerned because of their own personal health status or the just eagerness to be able to have the latest, most effective tools on board when it comes to prevention of severe illness and disease due to COVID. So we certainly are not seeing, we haven't overwhelmed our supply yet. And so certainly as we continue to have more providers come online in the community that have the bivalent booster available, we'll be able to have a more robust estimation of where we are probably in the next week or two once we get the next batch of vaccination data from the state.
And you said it's a little bit too early to know, or you're not sure yet what to anticipate for the fall. Like, what are some of the different scenarios you all have envisioned or are preparing for?
Virology is a complex science, and so understanding how the various subvariants and how the virus will mutate over time is really sort of, it's not a definitive answer of what we'll see in the future. So as I said, there are some subvariants that are being monitored very closely to see if they behave any differently than the current subvariants that are circulating. But there are several scenarios where there could be a new variant or subvariant that emerges that could either be more transmissible, that could have the potential to evade immunity in many ways. And so it's important, again, I think, for us to keep our surveillance efforts up, as well as all of our prevention activities and our vaccine efforts must stay central, so that we can ensure that if and when that does occur, that we're prepared. There's also the potential that we'll continue to see subvariants from the Omicron lineage, which may, especially with the bivalent boosters, may offer a greater level of protection in the community. And we may not see the kind of surge that we've seen in previous falls. But of course, those scenarios are largely going to contend on us as a community doing the right thing and getting vaccinated and taking precautions outside of just getting vaccinated, just making sure people stay prepared, stay home if you're sick, don't come to work, don't go to school if you're sick. And then, of course, testing. And if you need to get treatment, of course, we want you to do that so that we can keep people out of the hospital and keep those beds open for emergencies.
Follow-up question from Almaya White, WSOC TV.
Hey, so question for you. I know you were talking about how COVID is very much so real, and typically when we see kids go back to school, that's when we see the increase in COVID cases. Is there anything that parents should be doing, or would you recommend, anything parents should be doing? And also, too, I'm curious to know, do you think it's a good idea if they get the flu shot and the COVID-19 vaccine around the same time or at the same time?
Sure. Yeah, so you certainly can get your flu shot and your COVID vaccine booster at the same time. So that's certainly allowable and happens very often. And in fact, I'll be doing the same thing myself this week. But also for parents specifically, I think, we are waiting for the bivalent booster to be available for the 5 to 11-year-olds. Which I do think will happen in the next 2 weeks. And that will be, so I would certainly advise parents, if their child is eligible for a booster, to be on the lookout for the news from FDA and CDC pretty soon about the bivalent boosters for the 5 to 11-year-olds. And hopefully that will be approved quickly and then available quickly so that individuals can take advantage of that, again, the specialized booster. And